do start, I'd just like to point out that we have got the press here today. Okay, I know it's a public meeting, so I have to tell you that there is the press here today. Okay, so I hope nobody minds that. And for anybody that doesn't want to speak, up the back of the hall, there is speak out forms. Okay, and these are through Health Watch. And you can just sit it together. It's completely confidential, but if you don't feel like speaking out, that there's something that you do want to raise, then feel free to go up the back. We've got post-it notes for people that want to leave just messages about how they felt the evening went. So, so please, if you don't feel like, I just want you to know that that is there. So first of all, I wanted to just say welcome to everyone, whether you come here to listen, whether you've come here to ask questions, or whether you've come here to explain what's happened in the past and what is planned for the future. So thank you everybody for taking the time to come. Many of you will know that I'm a Tilbury girl. I've been born and bred in Tilbury. I've lived here all of my life, and I've brought my own children up here. 4 generations, that is, of Tilbury, you know, that I am here tonight, and that is why I care. And it's because I cared about Tilbury people that I got involved with politics in the first place. It's because I care about Tilbury people that I've represented them for the last 7 years as a local councillor. And it's because I care about Tilbury people that I've asked for this meeting here tonight. We have with us tonight what is very probably a confusing group of people. There are councillors and council officers, so if you are one of those, could I ask you to stand up and make yourself noticeable to people that are here? Any councillors? Councillors, yes? So that's the local councillors that are in the room. Thank you. Now everyone thinks that the council is responsible for everything, councillors are responsible for everything, and that they're there for everything that goes wrong, but that's not really so. Councillors like me, we're elected to represent you and try to make sure your views are represented in the corridors of power. We have no special powers being councillors. Council officers, on the other hand, are responsible for things like childcare, adult care and public health. That's trying to get you to stop smoking, but also to give you advice on NHS and make sure your GPs and hospitals are delivering the best health care possible. That's been our responsibility to do that for about the last 2 years. Then there's the NHS, although that's the National Health Service. You will all know, if you're residents here tonight, that it's not always that you get the best service from your National Health Service. We also have us with us this evening 2 lots of the NHS. That's Thurrock CCG and NHS England. So can I please ask the NHS Thurrock CCG to stand up so that people can see who you are? Thank you. And that's the clinical commissioning group, which is in charge of commissioning or buying in the services that we receive here in Thurrock. The CCG is mainly made up of GPs and officers, and it's their job to make sure that the hospitals and other health services, that they supply us and they pay for the services that you require as residents. I'd also like to get Kim to stand up. Kim is from Health Watch Thurrock. They are an independent organisation, collecting your views and representing you independently to the organisations that are here tonight, responsible for taking your feedback. So thank you very much for agreeing to sit on the top table with us here tonight. And thirdly, we have with us tonight NHS England. So could I ask NHS England to stand up, please? And their job is to make sure Tilbury, Thurrock and other areas across England are properly supplied with what we know as primary care services. That's our GPs, our dentists and our chemists. The lines of operation between the NHS organisations are a bit blurred, okay? But simply, what I've explained to you tonight is that's the services that you've got, and it's very, very my kind of way of putting it. So hopefully, like, you can get an idea of who's responsible for what. So Thurrock as a whole, and Tilbury in particular, has a major shortage of GPs. We all know that, and that in itself is having a big effect on our health. So as far as I'm concerned, we are here tonight that we are going to hear from NHS England about what they are going to do for us in Tilbury, and I want to know how quickly they're going to be able to deliver on that. In June, senior members of the NHS England reported to councillors on the challenges of Tilbury areas and admitted that Thurrock had the lowest ratios of GPs to patients, and that the area must be targeted to develop primary care and make it more attractive with better infrastructure and better GPs. NHS England is expected to now report back in December, but I want to hear what they've been doing in the months between when they came to the meeting and where we are now. They've admitted that it's pretty dreadful in Tilbury, and any of us that live in Tilbury know that it's pretty dire to try to get in contact with the GP, and then when you get there, the service that you get from your GP. Okay, so that's what I want, and I'd like to hear what they plan to do about putting that right. I've just got a couple of points that I need to make before we do move on. I'm going to be chairing this meeting tonight. Okay, so I want you all to speak out, those of you that can. So if anybody uses any initials, because it's easy for those that work in the sectors to start using acronyms, okay? So if they start saying CCG and commissioning this and doing that, put your hand up, because we need it to be back to basics so that we all understand what everyone's saying, so we've all got a clear idea of exactly what's being promised to us here tonight. And lastly,
excuse me, I'm so sorry.
that's okay, I've just got one more point. That's okay, I won't start again.
Okay, I'll catch up.
I'd just like everybody in here to remember that some of our guests are not local. Some of them have come a long way on a Tuesday evening to hear your views. So I'd like them to be able to say what they've got to say, for you to treat them with respect. So please listen to what they've got to say quietly. And I know that us Tilbury people can be really vocal, okay? We're not afraid of saying what we want to say, how we want to say it, okay? But please be polite. Please don't be rude, because if we are rude, okay, it weakens our points completely. Okay, so I'm going to now hand over to the next person. Thank you for listening to me, and thank you so much for coming out tonight. So I'm going to hand over to Sarah, okay, and she's going to tell you about the current GP situation here in Tilbury.
Good evening, everybody. Thank you, Councillor. I'm Sarah Lingard, and I'm a contracts manager at NHS England, and that role I'm involved with primary care contracts throughout the southwest area of Essex. What is NHS England and what's our role? NHS England was established in 2013 when there was a bit of a reform with the healthcare economy. We're a national organisation, and we are purchasers. We're not providers of healthcare, we're purchasers of healthcare. We've got a duty of partnership with the local authorities, Public Health England, the Care Quality Commission, and clinical commissioning groups. And other roles we have are in view of clinical networks. These are networks that focuses on different areas of health to ensure better outcomes, so such as cancer care, mental health care, cardiovascular care. As a national organisation, NHS England strives to improve care across the country and develop strategies to achieve better outcomes. In doing this, it's aspiring to meet the following goals: NHS services 7 days a week, more transparency and more choice, listening to patients and increasing patient participation, better data, informed commissioning and driving improved outcomes, and striving for higher standards and safer care. So what are primary care services? These are a fundamental part of NHS England's role. They include general medical services. These are the services that you get from your GP surgery. Patients should be able to access GP and nursing services between Monday and Friday from 8 o'clock in the morning till 6:30 in the evening. GPs and nurses should be providing care for acute episodes of illness, chronic disease management and terminal care. And they should also be offering services such as immunisation services, screening such as cervical smears, and promote healthier lifestyles to stop us becoming ill. Community pharmacy services. They're a key member of the primary care family, dispensing the medicines that your doctor prescribes. But they're also commissioned to provide other services, such as medicines use review, making sure you're taking the medicines correctly, providing self-care advice, promoting healthier lifestyles, such as stop smoking programs, and signposting patients to other services as needed. Currently, the Centre, NHS, is looking at how this role of a pharmacist can be furthered. And Thurrock CCG have currently got a bid for additional funding to bring pharmacists closer into GP surgeries to see if that can help again to improve care of patients. Community dental services. All patients should be able to access NHS dentistry. Dentists are contracted to provide oral health promotion, screening and to provide treatment when needed. Some dentists provide specialist services such as orthodontics when children need braces to straighten their teeth, sedation services and minor oral surgery. So some of that can be done in the community rather than you having to go to a hospital for a surgical procedure. And then finally, general ophthalmic services. These are the services that you get from your opticians, and predominantly they are sight testing and the dispensing of glasses and contact lenses when required, but they'll also screen the health of eyes, so if in that sight test your eyes have a problem, they'll refer you to the hospital for further care and treatment. So what's the picture in Tilbury at the moment? We currently have 4 GP practices, 4 pharmacies, 2 dental practices and 1 opticians. Until recently, Tilbury was served by 6 GP practices, but due to the retirement of both Dr. Saha and Dr. Dr. Makatapati, we're down to 4 surgeries. Sai Medical Centre, Medic House with Dr. Ramachandran, the Shahade Medical Centre and the Health Centre. There have been recent changes. The doctor's surgery closed in May this year, and that was following Dr. Makatapati's retirement and the lease on that building expiring and the landlord wishing to sell the building. Due to a partnership that was made by Dr. Makatapati and Sai Medical Centre, the patients that were seen at the doctor's surgery have now transferred to Sai Medical Centre. Dr. Suntralingam decided to retire a few months ago, and we now have College Health providing services at the Health Centre. And NHS England will be working with the CCG and other health partners to future plan what services, and that's why you're here tonight as well, to give us your views on what you want and what you need. Another recent change that some of you might be aware of is South Essex Emergency Doctors Service, known as SEEDS, was a GP cooperative that was formed by a number of GPs many years ago. They were a service that provided out-of-hours service for some surgeries in the area, and they would often provide Thursday afternoon cover or cover when GP practices close for education and training. This organisation is going to close on the 30th of November, but Thurrock CCG have commissioned the services of an organisation called IC24, which is going to provide that out-of-hours service.
TCG, please.
CCG, Clinical Commissioning Group. Sorry, the Clinical Commissioning Group. It is a typo, yeah. It's the Clinical Commissioning Group. My colleague's sitting to the left. IC24 is an out-of-hours provider that's got 20 years experience, and they currently provide out-of-hours services for the rest of Essex. Some more positive news.
Can I ask where IC24 are going to be based then? Because based on Seaford based in Thurrock Hospital, so where are IC24 going to be based?
They're going to be based in exactly the same place.
Okay,
Yeah. They are currently based there because they provide out-of-hours service for other Thurrock GP practices. So the patients should not see any change in service at all. The only change will be when they call up, they will get a message to call another number, or now you can just call 111 and get through to an out-of-hours service.
Thank you.
The Tilbury Hub. NHS England, to meet that aspiration of increasing health services and opening 7 days a week, is currently funding the GP hub service across Thurrock. Tilbury has a hub. It's based at the health centre, and it's currently opening on a Saturday and a Sunday and offering GP and nurse appointments. These appointments can be booked through your GP practice, and the service has been up and running probably for a couple of months now and is doing really, really well. We've funded this for 7 years, and it will continue if there is the need there, and those appointments are being filled on a Saturday and a Sunday to meet health need. I'm now going to hand you over to my colleague, Alison, who will talk a little bit more about the Healthcare Commission and other issues in the area.
Thank you, Sarah. Good evening, everyone. My name is Alison Cowie. I'm Head of Commissioning with NHS England, and I cover primary care across the whole of what we call South and West Essex, so from its north as Saffron Walden down along the Thames estuary right out to Southend. So, Councillor earlier gave us the challenge of describing what it is that we've been doing since we last came to the Council to report. And I think one of the important things to say from the very beginning is that we've not been doing this alone as NHS England. We are joined to the hip, I feel, with the Clinical Commissioning Group here in Thurrock. And we've been side by side, and I cover 5 CCG areas, and it feels that in the last few months I've seen more of Mandy than any of my other CCG colleagues. And I just want to give you that reassurance that we've not been sitting doing absolutely nothing. We've been having discussions, but as the local leaders for health strategy, we have got to work with the Clinical Commissioning Group, and we are doing that. Earlier on this week, there was quite a lot of press about the Care Quality Commission. Now, the Care Quality Commission is a regulatory body, so they're the ones that all practices need to register with, and they determine whether or not that practice is safe and is giving the necessary care to patients. Practices need to register with the Care Quality Commission, and what they do is they come out with a team, and it's an expert team of people that include nurses, doctors, as well as managers, they come out and they spend some time in a practice, they consult with patients, they listen to what patients have got to say about that practice, and then they formulate a view on whether or not they think that that practice is safe and delivering good quality care. In Tilbury, 3 out of the 4 practices have been visited by the Care Quality Commission. And it's a very different picture, and it's a disappointing picture as well as what we've seen. The Shahadi Medical Centre was deemed to be inadequate, and there were a number of recommendations that were made for that practice. The practice was re-inspected last week. I tried to get some feedback from the Care Quality Commission today, but they need to go through their processes, pull together their report, so they weren't very forthcoming in giving me any feedback. However, a couple of months ago, myself and Dr. Christine MacLeod, who's our medical director in NHS England, went and met with Dr. Shahadi, and he talked us through the type of improvements that he had made. And I was pleased to see that improvements had been made. I'd read the report that had came out, and I was really, really concerned about some of the signs that were up in the waiting room, things that were in the patient's leaflet, which I just didn't think were appropriate. But he clearly demonstrated to us when we sat in the waiting room, when we got sight of the patient letter, that he had taken note of what the CQC had said in their report, and he'd made some improvements. So we wait to hear back from Care Quality Commission as to what the re-inspection said last week. Then we had Tilbury Health Centre, and that was inspected at the time when Dr. Sunthra Lingam was practising there. It was also deemed to be inadequate. As Sarah has said, Dr. Sunthra Lingam retired from general practice, and we've now got a new provider in there called College Health. They're providing GP practice services, and we know from other practices that College Health have in the area, they've always been deemed good in terms of the Care Quality Commission inspections. We don't know yet when the Care Quality Commission will come out and re-inspect that practice, but we feel assured that the provider that we've got in there fares well with the Care Quality Commission. And then we've got Dr. Ramachandran's practice in Medic House. Care Quality Commission deemed that practice in need of improvement. The practice is actually being re-inspected this week. So if we were sitting here in a couple of weeks' time, we might be able to give you some feedback from that. But I think it's actually tomorrow that the Care Quality Commission are going to be there. But we've been in contact with Dr. Ramachandran. We know that he's been developing an action plan that has addressed a number of the areas that Care Quality Commission picked up in their first visit. We touched on earlier, sorry.
When were those inspections done?
The Shahadi Medical Centre was last year. Tilbury Health Centre was April-May time, was it? And Dr. Ramachandran in Medic House was towards the end of last year as well.
And when was the previous inspections, those inspections done?
No, these are the first ever inspections that these practices have had,
So
the Care Quality Commission.
Ensuring quality before these inspections?
There's a number of things. We hold a contract with practices, and there's various declarations that practices need to make to us. If there were things within that, if there were patient complaints that come in, if there was incidents that we knew that would happen, various teams would go into the practice and look at that. But the care quality regime is the sort of first time that we've had quite in-depth and intense visits into general practice.
Is the question about the presentation? Because there is a Q&A straight after this.
Yeah,
okay.
It's not been done yet. So what the Care Quality Commission do is, and I should have explained this in my presentation, is that they look at a range of different indicators and then they determine which practices they're going to visit. So at one point in time in the near future, all practices will be done, but Sy Medical Centre will be inspected. Yeah, I just can't say at this stage when. Okay? We touched on this earlier. We are struggling as both providers of services and commissioners of services with an ageing population. In Essex, we know that 46% of GPs are over the age of 50 and due to retire in the next 15 years. So we need to be planning for this. We've got a number of our practices that are what we call single-handed. So there's just one GP that holds the contract with us for services, and should anything happen to that GP, then there isn't another partner within the practice that can keep things running. 2 of our 4 Tilbury practices are what we call single-handed. We know that it's really hard to recruit GPs and nurses, and that's not just in Tilbury, that is across the country. And we know that we are dealing with a much older population in delivering our services. And as we all unfortunately age, we are more prone to more illnesses, long-term conditions that our GP practices will help us address. NHS England launched what we're calling our GP Workforce 10-point plan. And I apologise that the writing here is really small, but we do have a pack of our presentations that you can take away today. But there's 3 R's within this. It's about recruitment. It's about recruiting new GPs. And within recruitment, it's about encouraging doctors to come in to general practice. Someone deciding to go to medical school today may take between 7 and 10 years before they actually become qualified and go into general practice. So we are sort of dealing with it's kind of a bit of a gap within this, but we need to try and encourage more and more of the GPs, the doctors coming through the system to come into general practice. We also need to keep the doctors that we've got and to keep good doctors that we've got. So they need to, we're looking at how we develop primary care. It's not just about the doctors themselves, it's about all the other services that go on within your local GP practice. We need to understand why GPs are leaving general practice and going into either other parts of medicine or going off and doing completely different things. We need to make sure that we're investing in services around the GP as well as investing in training and development for the GPs themselves. And Sarah mentioned earlier the bid that the Clinical Commissioning Group have put in around community pharmacists. We're also looking at what training and development and support that we can give the whole practice, because your experience of general practice starts when you pick up the telephone, if you can get through to them, how the receptionist deals with you, what if you see the nurse, what your experience is there, as well as the doctor. So it's really important that we think about primary care general practice as a bigger, wider team. And then the third R that we're looking at is returners, and that's about encouraging those GPs that have left general practice to come back in. But the key thing with that is that we want to encourage good quality primary care to come back into the service. And we're looking at identifying that, but also putting some targeted investment by way of training to get their skills to where we want general practice to be in 2015. And just my final slide. We've also done a lot of work across Essex. All the clinical commissioning groups have been working very, very closely with Health Education England. They're the ones that support doctors that are interested in going through to become GPs. Colleagues in the CCG may wish to talk more about this, but in order to do the things that were on the previous slide, we're all working together on this one. And we've got a 2-year pilot which we're calling EPIC, and I'm hoping that primary care in Tilbury, in Essex, is going to be EPIC during the course of this initiative. And there is the first ever Essex Primary Care Careers Fair on Saturday the 14th of November. And in addition to that, the Clinical Commissioning Group is working really hard on developing its local workforce strategy. That's why tonight your views are really, really important, because ourselves and the Clinical Commissioning Group can't develop services without you telling us what it is that you think you need down here in Tilbury. Help us paint a picture, and then we can go back and look to get the necessary purchasing, the contracts in place that will ensure that that picture gets delivered here locally. Okay, thank you.
Thank you. Have you got a question?
As I just pushed doctors and nurses all over the world, what level of training do they have?
Sorry, I missed the last part of that.
A big push to put doctors and nurses all over the world.
Yeah.
What level of training do they have to be to come in?
I'll actually defer to my GP colleagues on that one.
Can I?
Yes.
Okay. A doctor needs to go through 5 years of university in this country. That's from after A levels. They go 5 years university, and then 2 years they work as an intern or the junior most level of doctors. From there on, they generally, if they are lucky, if they really got their minds fixed and focused, they can go directly into GP training, which is 3 to 4 years and could be extended to 5 years depending on what the Royal College decides. So from A levels, you're looking at about 9 to 10 years, but from qualification, you're looking at really between 7 to 10 years before a doctor makes up his mind to come into general practice and then start practicing independently. The problem we are facing is nobody wants to be a GP now. In 10 years' time, I might be the only GP standing here. It's like a Sunday market. I'll have to say, GPs, come here. I'm selling GPs today. That's something of what I might be doing. I've already started doing it, but I might have to make my voice a bit louder in future.
Could you just clarify, if GPs are recruited from overseas and not gone out through our...
Okay. There are two issues in that. If GPs are recruited from the European Union, they can come and work, their qualifications are recognized, they do not need a visa. But they are not the people who are willing to leave Europe, because their standard of living is higher, unfortunately. They get paid better in Europe and the healthcare is much superior. GPs coming from other parts of the world, they're not allowed in this country at the moment because of immigration legislation. A doctor who wants to come into any specialty in this country is allowed to come here for 2 years. Who in the right mind would move his family lock, stock and barrel to another alien world for just 2 years? So unfortunately, that is also the same with nurses. They've been asked to come into this country. Earlier, when I first moved in 15 years ago, I could come in and decide whether I wanted to stay or not. But currently, that possibility has been taken out for the last 4 or 5 years. 30 to 40% of NHS workforce not just GPs, but every part of NHS, physiotherapists, radiographers, nurses, doctors, consultants everywhere, is made up of overseas doctors, clinicians, etc. So we do not have an inflow from other parts of the world other than Europe, but Europeans don't find England very attractive, unfortunately.
Just to confirm, for nursing, it is slightly less training. It's 3 to 4 years to, depending on what course you do, to become a nurse. And, you know, we are seeing the role of nurses increase in general practice. So if you become a nurse practitioner, nurse prescriber, obviously you've got to do that additional training, probably a couple of years post your initial nurse training, to give you the skills and experience to be that advanced practitioner within in a practice. But I'm sure some of you, because I know Tilbury, there are nurse practitioners that have worked here. It's another area that needs to be looked at in view of developing our primary care.
Thank you for the presentation. Right, I'm just going to go to the Q&A now. Does that work for you? Okay, so we're going to have about half an hour, 40 minutes to answer anybody's questions. Okay, if you go through me, please don't shout out. If someone else is talking, you know, please let them finish, and then you'll have the chance to go back. I feel like I'm doing question time here. But what I'll also do is, although I do know people in the audience, I'm not going to name you as you speak, because I do know that it's being recorded and you may not want your name on that recording. So I'll just say what row, you know, man with the glasses, etc., you know, so that we don't identify people by names in the filming and the Q&A session. So as you had your hand up first, the man at the back, sorry.
Yeah, the thing is, I mean, when you look at that presentation there, you saw inadequate, and unsatisfactory. I think the first thing that ought to be identified is that the CQC looks at every single thing that doctor's surgery, and I think it should be made aware, if it is a general known fact, that no patient's health has been compromised by an inadequate surgery. It could be that you might notice for it, you might like the chairs are made out of surgery, or the tables in the way. I think it needs to be put as a sort of central to children. No children patient's health has been compromised by an inadequate CQC report.
Who's going to answer? Does somebody want to answer that?
Sorry, but I struggled to know what the question was there. I thought it was more a statement.
People in children patients,
yeah.
if they've got a surgery that says it's inadequate,
yeah,
they should be aware that their health hasn't been compromised because of that inadequate report.
So how does somebody know that their health hasn't been compromised on a personal basis because of the inadequate report that's come back?
Okay. So when the Care Quality Commission published their report, there's different sections within it. And I'm struggling to remember off the top of my head on the spot here this evening what those different sections are. And what the Care Quality Commission do is, if there's more than one of those different sections that are deemed to be inadequate, then overall the practice is inadequate. So patients will get some feedback from that report to know, to get a feel for which areas within the practice are deemed to be inadequate. In terms of how you know as an individual, you will have your own experiences of primary care. If there is something that the population and you and as an individual are not happy about, we always want to hear from patients. But unless you're telling us, there's nothing that, other than when CQC go through, those kind of triggers don't necessarily go off for us to say there's maybe something not quite right there.
Was it medically impractical or analysis? Was it medically good at some of the things around the housing?
Can I come in here a minute?
Yeah.
I think you're quite right in what you say. The Care Quality Commission looks at a whole ream of things, quite a lot of things, and sometimes they will rate something as inadequate, not because something has happened, because they don't feel that the practice has got the process in place to stop something happening. So just because a practice has been rated inadequate doesn't mean that all the care that's been delivered in the practice is not to standard. And it's a very intense report, and I think, you know, patients should look at the report, have a read, and it will give you an idea of where your GP practice was falling down. And, you know, as Alison said within her presentation, when we talked about Dr. Shahade, some of the things that the CQC picked up on was how he was communicating to patients, that they didn't feel that that was quite the right way to communicate with patients. There were some clinical things, but they weren't saying you have done harm to patients. They're just saying we don't feel perhaps you have the right processes in place to ensure the safety. So it's very hard to speak generally because each CQC report is different, because it's a different practice that has slightly different ways of running things. But as Alison said, read the report, and then I'm sure most practices would be happy if patients have a query about what CQ is saying to answer your queries about it.
Can I just ask where people can get a copy of that report, because I'm sure like they wouldn't know the first place where to get it, and to follow on from that man's question, in some, if you do find inadequate care, and I'm not talking about the tables and the chairs, if there was inadequate care, how do you ensure that that patient knows that they've received inadequate care and that it's put right?
So,
because that's what people really want to know. Have I received good enough care?
So, if something goes wrong in a practice, the practice needs to declare an incident, and they need to tell us as commissioners that that has happened. We ask them to investigate it, and depending on the issue, we may actually put in our own experts, and those experts may come from the clinical commissioning group, or they may come from NHS England. So sometimes our medical director and her team may go down to a practice to visit. Sometimes members of my team who lead immunisations will go into a practice and look at the procedures. So we get to know that way, and then on the back of that we can take necessary action. You know, first and foremost, we'd want to make sure that patients are safe. So we work with the practice. We'd be encouraging, and I think the practices must write out to the patients to tell them this has happened, but to put it in the context of this is the overall risk to you. But yeah, practices will, if they've been affected by something, say it might be something's gone wrong with a vaccine that's been given out during immunisations, we will write out and we will ensure that they're advised. Yeah?
To access the reports, if you've got a computer at home or the local library's got a computer, you just put Care Quality Commission, bring up their website, and it's quite an easy website to use. You can just put the name of your GP surgery in, and it will come up, it will tell you when they were inspected, and you can look at the whole report and the recommendations that CQC made. And that's a good place to look when new people coming into the area, or if you're not happy with your current GP practice, you can move. So again, going on and seeing the report to see where you know, a practice is performing well or needs improvement. But to reassure you, we have seen the improvements in those practices that have not fared very well in their initial inspection.
I'm just going to take one more. Kim's just asked to come back to speak to the audience, and then we'll move on to the next person. Yeah?
Thank you. As you know, Council Orwell introduced me as being Health Watch, and we are an independent organisation, which has been said. And we've done a lot of work over here leading up to before the CQC inspections, and it was because of some of the voices that we heard, and because some of the stories and some of the concerns and some of the complaints that were coming to us about the GPs in Tilbury, we took those complaints, we we pass them to NHS England, but we also pass them to CQC. So we speak to the CQC directly and raise any concerns that the patients have about their GP. So that isn't about the sort of things that have been said about what's on notices. Some of it is that. I know that there's been some quite concerning reports from some of the doctors over here, which we've passed on, and that has been people's experiences, which have caused concern and have caused a lot of worry. So we pass that on to the CQC. They very much ask us about what's happening in the area. They also want to know if we have any concerns about GPs. So your voices to us are the ones that guide the CQC in some areas. They will change a decision about they might be going to one GP and they're going to go to another one instead. And in fact, we met with them a few weeks ago to pass over another lot of issues, not necessarily in Tilbury, but somewhere else in Thurrock. So your voices, as you tell the story, as you raise your concerns, do get back to the right people if you come via us. You can complain to your GP surgery, but if we know, we keep a log of what's happening. So that's the work that we do and how those voices get forward.
Okay. Lady in the second row.
Yeah, it's very confusing about tonight's meeting. That's what I want to raise. One newspaper said this meeting was at 6 o'clock. One newspaper said it was 7 o'clock. And not everybody gets the Enquirer, not everybody gets the Gazette. There wasn't really a lot of advertising. This is only a small representation of the town, and I'm quite sure we would have had a far heavier gathering here tonight if it had been advertised a bit more.
Well, we'll still be here at 7 o'clock, so if anybody comes in,
yeah.
you know, we'll
well,
make
I
sure.
didn't know till last night at 8 o'clock that it was 6 o'clock and not 7 o'clock. Just a small point.
I didn't do that, so and we have checked with the papers, and they both said
the Gazette on the front says 7 o'clock. The Enquirer says 6 o'clock.
Well, it's definitely 6 o'clock, and I've had it all over social media, and I have.
Yeah, but just a point I wanted to make that these people would know there would be more people here.
Well, it's 5 to 7. If people come in, we'll make sure they get their voices heard. I'm going to next. I've seen you at the back. But there's a man in front of you, okay? And then I'll come to you.
Right. What I'd like to know is how do you deem that the surgeries will need a partner within that surgery? How many patients does that surgery need? Because there's certain places around here that have deemed to me that have got a lot of patients but only one main man. Now, how do you get a GP to come out of where he's coming from to become a GP and work alongside somebody else? Because if that other GP goes out sick, he's covered.
How we buy those GP services is through a contract, and a lot of our GPs practices are working under a contract that came into play in 2004. A lot of the GP practices were already established, but they moved to this new contract. So, as we mentioned, it is up to a GP whether they are single-handed, so just one GP who runs the contract, or they can work in a partnership. It is their choice. There's no legislation, no law that says there needs to be X amount of GPs to hold a contract. So with our single-handed GPs, it's them that hold the contract, but then they are responsible for getting GPs and nurses to work alongside them to deliver the care. With a partnership, those GPs have made the decision to work together and hold the contract together. This is where those contracts don't state a minimum or a maximum. They are asked to provide reasonable access. And that is what we try and monitor. And when we get complaints from patients that they can't get appointments, we are going back to those practices and talking to them about their staffing. Some practices are extremely responsive and they will do their best, but we are having this challenge that there is not enough GPs around. Our others, I'll be truthful, are not as responsive, and that's where NHS England can step up and take further actions against practices in view of delivering that reasonable access to patients. But unfortunately, there is not a defined number of GPs to patients. I think Ian will, when he speaks, will talk about national figures, but there is not within the contracts that the GPs work for. Was there another part to your question?
No.
Is that?
Yeah. Can I ask a question? There's not legislation that states there should be 1 or 2 or 6 GPs, but how does it work with the numbers of patients that people have on their lists? For example, is one patient, is one doctor, can he have 6,000 patients on his list, for example? And if he does, what's your action?
He can, as long as he's the one person holding the contract, as long as he's bringing other GPs and clinical staff to provide the care. And access results, national survey results, feedback from patients are the things that alert NHS England to concerns, and that's when we will pick it up. There is a different type of contract nationally. Probably about 4 years ago, NHS England, or the NHS Centre, so the Department of Health, put a mandate out to say we don't want these old types of contracts anymore. So when we now buy a new GP service, we use a contract called an alternative personal medical services contract, which allows us to be more specific. So we can prescribe in that how many appointments we would expect that contract to deliver. And at the moment we look about 72 appointments per 1,000 patients. We would be expecting a new contractor to provide. So this new contract gives us more weight in what we can expect our GP services to be delivering.
Thank you. Sorry, Chair, can I just come back? Because you've told us, very quickly, you've told us a lot about the contract. I asked you about the numbers per GPs and what we can expect. So what is an average number of GPs nationally, and what's the average number of patients per GP nationally, and what do we have, not expect, in Tilbury?
Right, I haven't done those statistics, and I apologise that we haven't got that. Ian has got some. They're a little bit skewed because we have GPs in Tilbury that have a number of practices. We had the patient list size up there, and at the end of the day we look at those access issues. What used to be quoted was 1,800 patients per whole-time equivalent GP. That used to be the marker that would be used, but it varies depending, and I think Ian will mention about whether deprivation plays into that, and I think Ian is going to speak about what he feels might be the level of GP. We know we need to increase the GP levels in Tilbury.
Hold on for
Thank
15 minutes.
you, Ian.
Councillor
I'm
Rice,
sure you'll
I'll
be more
wait.
clear.
And Ian's going to give all of the stats that I've seen them, and they're pretty horrendous, some of the things that are on his presentation. But for now, I'm going to carry on with the questioning, because I think that tonight is about the community, and I think that we have a job to make sure that people's voices are heard, because for a long time Tilbury residents have felt that their voices are not heard. So I'm going up to the back. Okay.
Guys, I'm very worried about people who are disabled, who are not facing to get this in your health checks, because if it's stopping, I don't want to see them suffering and dying. And I don't know how you're going to cope with your, I know you've got to bring your ground job, but I don't understand why you're not able to put any action towards people who are facing this difficulties, because I'm feeling as if that you're not dealing with anyone who's suffering in pain and they're dying and they don't have enough any health checks. So what I How are you going to deal with that as well?
People with disabilities, yeah, especially.
So, learning disabilities health checks is something that is a top priority for us. We've gone out with what we call an enhanced service agreement, so it's an additional service on top of the GP contract. So we know which practices have said to us, we are going to deliver this for our population. But it's an optional thing, and we know that we've got some practices who have not taken up this opportunity to provide that service. In the moment, we're negotiating with another provider to come in and take that population within those practices and carry out their health check. We've had to go to a number of different providers in order to try and get someone to do it, but I feel sure that we've got someone now who is going to do that. So it's a key thing for us. We're waiting for some data to come back from the GP practices that are carrying out the health checks to find out how they're getting on, what the level of activity is, and if we have a look at that and think, do you know what, and not enough health checks have been carried out this quarter, we will be having a conversation with those practices, find out if they've got any problems in doing that, help them to resolve any of those problems, but to also speak to them about this alternative provider that we've got with a view to maybe patients having choice, so you could either go to your GP practice or go to this other provider to get the health checks done.
I think you're right, but I think that accent is that I was saying, because I've seen my ex-director been through that way, because I've seen that no matter what you say, because the accent speak by word, and I don't know why, if you're doing all the new are using, and you're not able to provide nothing in place, so you can say it, but then you're not getting that into action.
So I'm hoping to be able to publicly say in the next couple of weeks, this is the provider that will be doing these health checks.
Okay. Do you want to absolutely add to it
Well,
on behalf of
I
him?
know that you're new in post, but the reality for people with learning disabilities in Tilbury, because we have known some that have died, sadly, Dr. Shahada made a decision that he doesn't want to do the enhanced service. He's entitled to say that, but he also argued that they weren't valuable, which there is clinical things that mean they are. So we've had our big sign online, which people can read. However, people have been waiting 18 months. I mean, no disrespect to NHS England, but when the clinical commissioning group were in charge, we actually had someone in place. Then it got forgotten, and it's been a year and a half. So if you have a GP in Thurrock that doesn't do the checks, you've been waiting 18 months now for a health check, because, no disrespect, it wasn't you, the NHS England forgot to commission it. When we're close to the clinical commissioning group, they understand this community, and they know these people, and they do commission things correctly. Our plea to you is to give the money to the CCG, because they will get it right for the people of Thurrock.
We will be commissioning this together. What I will say is that when I mentioned earlier that I went to meet with Dr. Shahadi to talk about his Care Quality Commission report, and I specifically talked to him about LD health checks, and he has actually signed up to deliver it. So he's telling us that he's signed up to deliver it, but he also gave me a commitment that he would allow another provider to come in to do the LD health checks for his patients. So when I've got that other provider, I will be looking at, right, where are we prioritising? And I think what I've heard here this evening is that I need to be prioritising Tilbury.
Absolutely. Okay, so it's nice of that. Thank you. The lady at the back has been very patient.
To be honest, my impression of GPs, not all, certainly one in particular, which I won't know because I think that's quite unprofessional to do it, but their opinion of speaking up when things are wrong within their surgery is basically to strike you off as a patient and put up and shut up. What I'd like to see is change within NHS England, because to be fair to CCG, I've had a better response from these guys this past week than what I've had from NHS England in over 2 weeks. So what are you guys going to do to improve that service so patients have got a voice service users can speak up when something's wrong and are not scared to do so without the fear of being striked off.
There shouldn't be that fear. Everybody should be able to voice their opinion. As long as they ensure that they do it in a way that is exactly what our councillor said at the top of this meeting, in view about everybody respecting each other. Our GP practices have a tough job. They are struggling out there. So, but that shouldn't stop them receiving feedback. I'm sorry if it has taken 2 weeks for your complaint or concerns to get to us. Patients are asked to go to a central complaints line, and then it gets fed down to the local team. So, you know, if you want to, after the end of the meeting, give me your name and details if you're happy for that, then I will track back to see why it's taken such a long time.
This was the whole reason I came to this meeting today. I'm probably one of the youngest members sitting here, but you know what, I've got a big voice, and as I said to CCG, I've used it to the max capabilities I possibly can. My surgery, basically I was struck off for going there 8 weeks ago for asking for a smear test. Now bearing in mind I've got a history of that within my family, that's what I asked for. I didn't get that. Now only on Friday, due to being proactive myself, I managed to obtain my results myself, which was actually abnormal. The practice manager of the GP I'm under, her opinion was I've wasted far too much time of surgery time. Now 26 to be told that I've got abnormal smear results, with not even being able to have my partner in a room, I had to have a police officer whilst that information was given to me. And that from a high level absolutely stinks from any NHS professional that condones that behaviour from a GP is shocking within itself. And I just hope and pray that someone has got as much strength as I have to come here today. It might be an embarrassing problem, but I'm not scared to speak up. And I put it to anyone on the floor that has the same issues with the GP, so Medical Centre, to voice it. Because I know I'm not the only one that's suffering with them at the minute.
Good one.
This isn't the forum, I think, to get into individual situations. As I said, I'm more than happy to stay back afterwards if you want to have a chat, and I want to find out.
An expansion at Shahada Medical Centre, and I know the practice manager's here. I felt in safer care and hands with those guys than what I've done in 2 years at Sy Medical Centre. That clearly shows an issue. And what Sy Medical says, we've got 6,000 patients. Yes, we know they've got 6,000 patients, but that's also 6,000 patients of public funding money that those guys get to treat those 6,000 patients. If they can't handle it, speak up to the Primary Care Trust, CCG, you guys, and actually more GPs. And yes, we know training is long-winded, but surely the way they deal with patients from the initial point you pick up that phone needs to be changed. Receptionists put the phones down and they're incredibly rude.
And I think this is what Alison was saying. It is about the whole package, not just GPs, etc. So I will stay behind afterwards and get your name and details so we can track why it took so long for NHS England to respond. But I'd like to thank you for coming. And if you have a voice, I've been working with GP practices for quite a while, and I know one of the areas that we look at is screening for cervical smears and screening for disease and illness that affect that area. It's not an easy thing to talk about, and it's quite a low uptake in some of the thorough areas, and a voice like yours would be great to try and encourage other people to have it done.
Even when you can't get one from your GP, 8 weeks is a long time, especially when it comes to cervical cancer. That's crucial time as far as I'm concerned. But even if you go to outreach patients, Grace Walking Centre, all the other organisations within the local area, not one person can do it as an emergency. Why is that facility not in place? That should have been there months, years ago, in fact, to potentially save lives. It's crazy. Absolutely crazy. And that's something I would really like to see changed.
Lovely. And
I totally agree with you. And the next session, and anybody that's got their hand up, and the lady at the back, I have got you, but anybody that's had your hand up, I've got you on my list, okay? We'll take the questions that are already, that I've got, because I've still got back 5 people that have had their hands up, that I've acknowledged that they've had their hands up. But we will talk about the problems and the vision and how you can get involved, so you make sure that young people like yourself or older people do have access to smears, because I think that you are bang on right, okay? And I back you for saying that, and taking and having the guts to come in and say that in a room full of strangers, you know, I take my hat off to you, okay? Right, I am going to go to the man on the side over here.
My question is really asking being in one practice with a single GP. I'm assuming it's a single GP. That may link also to retention and recruitment, which may be a problem if particularly GPs are under stress and under pressure with far too many patients on their books. Does that sound more or less what you're saying? I think you're very right in what you're saying. Two GPs for 6,000 patients. So their capitation rates, and possibly if we could have some legislation afoot to prevent too many patients being in small practices, if that makes my question quite clear. I think Councillor Russ was touching on that, so if I may.
Can I just check back what I think you've asked there? Is
capitation rates, any legislation, any control over capitation rates that may exist in areas of high medical density, for example, in Tilbury, we know it is, I certainly know it relates to working health promotion. Is there any legislation for, or any plan for, to prevent high capitation rates, where possibly the recruitment and retention of GPs are under stress with so many patients, and indeed any evidence of poor service?
So, I'm not aware of any legislation that is in place for that, and I am not aware of any legislation that may be forthcoming to say that. But that's certainly, you know, some feedback that we will find a way to get back into the system and into the people that are leading the 10-point plan and say this is what we heard tonight.
A lot of great deal of patience.
Yeah, but we've only got 4 surgeries. We've only got 4 surgeries. That's all we've got in Tilbury.
I'm aware of that.
Thank you. The gentleman in the second row, thank you for being patient.
I saw Tilbury Health, Saturday, Sunday. When is it operational?
It opens from 9 till 12 on a Saturday and 9 till 12 on a Sunday.
When? I haven't seen it.
No.
It's open now. It's been open for the last couple of months.
Where is it?
Yeah. Where is it? It's in the health centre.
That's the doctors next to the clinic. I have to do it by location in Tilbury.
Yeah.
You know, so it's the one next to the health clinic, the baby clinic.
It's a service that's still developing. NHS England, with the contract holder, we're being very flexible to allow that service to change as is need. At the moment, if you want one of those appointments, you book it through your own GP practice. So say you call there on a Friday, you can't get an appointment, you ask, can I have one for the hub on the Saturday or the Sunday? And they should give you that appointment. That's sort of working quite well. The nurse appointments are still not being fully utilised. So I'd like to see some of those nurse appointments filled up with more young women having their smears. You know, that's a route that we can go down. They're looking at how they can perhaps open up those appointments to more urgent. So rather than booking it through the practice, how you could on a Saturday morning, if you wake up feeling unwell, that instead of the out of hours, you can go to your Tilbury hub instead. But we're just working the communication route for that and to ensure that the service is safe and that you're not turning up and there's not an appointment, etc. But it is a really exciting thing, and what's good about that, it's actually bringing the GPs more together, because even though GPs are all in healthcare, they tend to work quite in isolation and just look at their own surgery, where we've got this problem of recruitment for GPs. It's about can we get them to work close together, sharing resources and providing a better service. And the hub is one step that I think will help develop that closer working between your GP surgeries.
Thank you. Lady at the front.
You could be along.
Oh, I know. We're in a public meeting.
You say about GPs on their own. How many patients can they have before you say, hold up, that's too many?
Basically, if their access scores are dire, so we do look at those national access scores. We've got friends and family tests now, which is patients feeding back, and that's why when you're in your GP, if you see a friends and family test card, fill it in. Give us that form, because the national team look at that.
And how about the age of some of the doctors?
There is no GP retirement age. A GP can continue practicing until he decides to retire. There is.
So the whole thing is, some of these doctors, I'll tell you now, I don't have a doctor in Tilbury. I have a doctor somewhere else. But
There used to be a doctor that I had in Tilbury, and to be truthful, he should have retired years ago. Because it was frightening. I had kidney stones. I went in hospital, had it done, came out, and I was in agony. And he said there was nothing wrong. And eventually I just gave up. I phoned my husband, he took me down to the hospital, and I had an infection. So we decided to go somewhere else. But I did complain about him, but he still carries on.
There's been a recent development in GPs have to go through a revalidation. So they have to provide evidence of their training and their practice, and that certainly, I think, has put more focus on things, and perhaps through that revalidation we might be seeing GPs retiring at an earlier age than they would have before.
I mean,
so there are developments in view of trying to monitor that element of skill and competency as a GP gets older, because it's like all of this.
I mean,
different individuals will react differently.
This particular doctor has patients that we know of, but then he'll have a locum come in for a few weeks, and then it goes all back to, you know, him just on his own, and it's not on really.
Thank you. I'm going to move on. There's a lady at the back indicated, and then I've got the gentleman there. Okay.
Getting back to Dr. Shahada, you say about he's going to do this and he's going to do that. So there's been a rumour going around for the last year that he's intending to leave. So is he going to leave or isn't he going to leave?
Sure, one of the panel will be able to tell Dr. Shahada.
At this moment, until Dr. Shahadi sends us a letter that indicates that he's going to retire or he wants to give up his contract that he's got with us, we don't know what his intentions are. So if that happens, then we'll know where he is. But at this point in time, he hasn't sent us anything to confirm retirement or that he wants to give up his contract.
Thank you. I'm sorry. I've got the gentleman at the back, then I'm going to move on to the next item because it's just as important, because the next item is the future. And the future is where we need to move on to. So I've got the gentleman there, then after the meeting, anybody that's got any questions for the panel, then please pick up with the panel. Because there will be a bit of time at the end for personal, because I know some people may have a question that they don't want to ask publicly, but again, you know, use the ping pongs at the back or speak to a member of the panel after the meeting. So last question.
Yeah, and I agree with what the young lady was saying about the doctor's attitudes. I mean, it's not just in that surgery, it's in other surgeries. But what do we do as a patient when we're actively told by practice managers to complain? If we do complain, then we're threatened with being thrown out. Are they looking at themselves? What do you do then?
You need to let NHS England know.
And Health Watch. You need to go to Health Watch as well, because they're your independent voice.
To be perfectly honest, I wrote to NHS England and I'm still waiting to reply. Nearly 3 weeks now. Health Watch, instantly. Congratulations, Kim, by the way. So, when you go into surgeries, and you just mentioned revalidation, does that happen to locals as well? So some of their attitudes need as well.
Yes.
There's some really stinks at times. And so when they sit there and threaten you, well, you can get out or I'll throw you out, what do we do then?
Okay, so the lady at the back is going to talk to Sarah to give details. At the end, if you give me your details, then we can track back and see what's happened.
I'm grateful for what you're saying, but that is the third time I've given details now.
Okay.
And as I say, when you go into surgery and you're actively encouraged by surgery staff to fill in complaint forms, there's something drastically wrong in there.
Okay.
It shouldn't be happening, should it? They should use
No.
them on the back.
You need to make sure that you're giving it that it's almost like the practice are encouraging you to complain. I take it it's not, it's reception staff that are potentially asking you to do that?
The reason is because they're impacted as well with the locums' actions and the way people are coming out of the surgery after seeing the locum. So they get it first hand off the patient. So that extra point you said, bloody doctor's useless, was what you just said or did.
Yeah, so I'm now understanding a bit more about why I don't see many complaints. And what I've heard tonight from more than one person is that you don't want to complain because this fear that you're going to be asked to join another practice or struck off. So we need to be doing something about that. As NHS England, we need to think about how we are dealing with complaints, but I also will look to our partners in the clinical commissioning group to see what it is that we can do more locally with the practices and with the GPs so that you don't have that fear. Yeah?
Just one quick point regarding complaints as well. I did ask to speak to someone from the provider in the Tilbury surgery, and their answer was, because we didn't start there at the time this incident happened to you, I'm not prepared to discuss it. But I thought, well, surely out of courtesy even, you could have said, well, I'll have a little chat with him, see if there's anything I can do. Not to just dismiss me straight out of hand. Okay. Which again doesn't bode well for, further patients or anyone else.
Yeah. Okay. Can I just remind people quickly as well, for those that have computers and are quite computer literate, because I recognise not everybody is, I'm not that great myself, but NHS Choices is a way to provide your feedback about your experience at your practice. It's good if you can put a name there, you should get a response back, but if you don't feel you can put your name there, you can leave an anonymous comment, and the practice should look at that. NHS England certainly do. When I've got concerns about a practice, I will go onto the NHS Choices website and I will look at the comments that patients have left, good and bad. And I'll be looking at whether those practices have responded to those comments made. And those comments then are available to the public, people moving into Tilbury, they can go on there and see, well, which practices are getting the good, better comments, which ones are perhaps not.
Yeah. And can I just encourage you to complain about it, to not only complain, but to also give us feedback when things go right? Because if we know that something's going right in a practice, we can maybe use that.
Trying your best.
I hope that from here on in we'll start to see some good things, but I appreciate there's lots of feedback that you want to give us back. But we will use those examples of good things and share them amongst the primary care community. And a little bit of competition between practices is sometimes a good thing.
I'm going to move on now. Okay, we've really run over time, so I just want to move on to the next item. But before I do, there's the hub on a Tuesday morning, which is Mondays and Fridays. I'll maybe move days. Mondays and Fridays. The Tilbury Library is now the hub. It is manned. If you want to get a copy of that document downloaded, you can go to the hub, and people from the hub are here. I've also asked if you've got feedback forms that you can put in there, that's fine. If not, I'm going to make available Health Watch ones to make sure that Tilbury people have an independent place to go with their complaints. Okay, so if you've got something that people can fill in, that's fine. I've got no favouritism, but I do want to make sure that my residents have every opportunity to feed in and make sure that their concerns are being heard, because until now, we haven't had our voices heard. Yeah. I could stand here and give you 5 reasons why I think that what I think of the doctor's surgeries in Tilbury, right? But I won't do that publicly because I think it's for my residents tonight. But I will make sure that these are available. You want to see a copy of that report, you can go there. And after the overview and scrutiny meeting in December, I will make sure that copies of that ONS meeting and anything that's said at that meeting are publicly available in the hub as well. Yeah. Okay? Because it's time for us to make sure that we do hold everybody to account, because we can't afford any more mistakes. Okay? So I am going to move on to the next item. Okay? And so I'm going to move on, and I'm really, really sorry that we've left you sitting there so long. Is he all technoed up?
Not yet, not
Oh,
yet.
okay,
Yeah.
he's not
Not
technoed
yet.
up.
Sorry, nearly. Keep chatting.
Okay. I've been talking tonight. Everybody that knows me. So if you want me to carry on chatting, I'll carry on.
I work in Thurrock, I live in Thurrock, I also dream in Thurrock, which is the most important part of life. I passionately believe that we have this opportunity today to shape the care we provide for Thurrock. When I go represent GPs nationally and locally in London and everywhere, the first thing everyone asks me, Raja, where are you from? I said, I'm from Thurrock. I said, where is Thurrock? So don't you know where Thurrock is? You got Dartford Bridge, you got Lakes. Oh yes, I love Lakeside. Well, that is where Thurrock is. It is not about the shopping experience we provide. That is to rake in the money for our council and our businesses and our youngsters who are looking for work. It is about providing health care that will keep them in Thurrock. We are sitting in this fantastic school here, an academy. We got the primary academy, and then you got the supplementary, the Gateway Academy, where these children can graduate on and go to Gateway. And then from there on, they can go to colleges in Thurrock and then to universities either in Essex or nationally. But what we want them to do is when they go nationally to qualify, we want to bring them back here. We want to bring them back here to live in Thurrock, to work in Thurrock, and also provide services which, as a Thurrock resident, I expect to be as world-class. Not nationally, but world-class service. We are in a situation today not because of choice, but because something has happened, but we see this as an opportunity to work together to improve it. Councillor Worrell introduced the talk today saying, we are working in a place where the lines are blurred between organizations. In a way, that is great, because if we all have a path that leads to some different direction, we would close our eyes and follow that path. But when the lines are blurred between the clinical commissioning groups, NHS England, Thurrock Council, Health Watch, we are going to have to work together to clarify these boundaries. And because these lines are blurred, we are here today sitting together. We have an evening. I've never seen such big representation, not from the organization. I do not worry about my organization, your organization, or their organization. I'm worried about patients who sit in front of me today. I'm really impressed, pleasantly surprised, in fact, to see so many Tilbury residents sat here today, asking me questions, asking everybody questions, and not just satisfied with questions, but asking questions where you get a satisfactory answer. This is what I like about Thurrock. We have been in the clinical commissioning group for the last 2 to 3 years. We have picked up the service we provided. We have improved it. That's what I'm trying to say. We have blocked many services that were leaving Thurrock, heading off to the greener pastures, but we brought them back. We were last week, the same day, Tuesday, we were sat in Thurrock Council chambers fighting for a cause to retain services that are close to Tilbury residents, Thurrock residents, and not for them having to travel all the way down eastwards, not to Europe, but to South End, which is not better than Thurrock, believe me. We are in a better place. Gibraltar may have a rock, but Thurrock has got its rock, and that rock is Tilbury, I'm afraid. I'm not afraid, I'm happy it's Tilbury. The rock in Tilbury has been rocked. That means the foundation of Thurrock has been rocked here today. We are going to work together to improve services. We want to make sure that the health service in Tilbury, in Thurrock, is the best in the world. Nationally, we've asked questions about what is the GP workforce. We have about 30 to 35,000 GPs in England. Forget about Scotland and Wales. They've got a different government. They are represented and funded differently. And believe me, people are tempted to go across the border. But we're not going to let them go even across Thurrock. We're going to have to ask them to show their passports to leave Thurrock. We are shot by many GPs. we are not starting off neutral here. We are starting off actually in the basement of health service. We are short nationally of GPs. We are about minimum 5 to 10,000 GPs short nationally. In Tarak, we are about 38 to 48 GPs short. Tarak, we've got separate figures. I'm not going to steal the thunder from Ian's show. He's going to tell us exactly how many GPs we have in Tarak and how many more we need in future. We've got the WWW crisis. It's not the World Wide Web. It is workforce, workload, and workplace. Workload-wise, there has been an increase by about 30 to 40% increase in GP workload over the last 5 years. And that is an unprecedented increase, and it's only going skyward. Our population, unfortunately, has not kept up with this workload. If it has kept up with this 30 to 40% increase, we would not have a single appointment left in this country for anybody to access. Then comes the workforce, which I've already clearly explained. We are short of GPs. We are short of GPs, nurses, healthcare assistants, consultants, physiotherapists, everybody in the workforce, we are short. But particularly GPs, we are really struggling. Primary care does not represent just GPs. It represents any sort of care that is being provided in the community where you don't have to go to the hospital. And primary care starts with GPs as the heads or people who hold contract, but together they've got nurses, they've got even receptionists. We can't recruit receptionists in Tarak. We're having to advertise. We're having to beg people to stay back and work as a receptionist. We're having to beg people to come in and work as a nurse. We're having to literally beg youngsters to take up nursing as a career, to take up any health service as a career. We are struggling, and this has been recognized. Tarak is one of the most under-doctored areas, not in Essex, but in the country. And this has been recognized nationally. When I was speaking to many people in the past, Tarak was described, I'm not going to quote who said this, Tarak was described as a basket case. I looked up straight in his eye and told him, you're going to regret what you have said. And 2 months ago, he called me and said, Raja, you have made a difference. And the reason why I say this, Tarak is one of the first counties in the whole of England to provide the weekend hub service. We got 4 hubs working functionally in Tarak. Tilbury, we got Corringham, we got Purfleet, and here we have Grace. We were in the local news. We were being appreciated. And this idea was thought of even before the national government sitting in London had thought about it. So well done, Tarak. Well done, patients, because you had told us what you wanted. And we were working in partnership with everybody on the ground to get this going. And it's doing well. I would like to really thank all of you for your support in that. In terms of workplace development, we've got surgeries which started off, primary care, so GP surgery, started off generally in people's front office rooms, at GP's own houses. And they slowly then developed on to take over the entire house. The GP had to be kicked out to find another house. But that can't work now. We need to think ahead. The challenges are more than what can be provided in a small GP surgery. So we need to develop the workplace as well. NHS England is helping us with funding for that. We've been fighting all over Tarak, we've been fighting all over nationally to have more funds. I can say that we have been actually scouting for properties in Tarak, along with the council office in the back seat of the car, to look for properties which could be suitable, to give us a new workplace. This new workplace, I'm not worried about whether it's all singing and dancing. I'm more particular about whether it will serve the needs of what you want, not the needs of what I want. I'm not worried about whether I sit in a posh air-conditioned office to see my patient. I'm worried about what can I provide from that surface I work in. And that is why I like the involvement of every patient today. Kim has been very helpful with bringing in the views of patients. We have a strong commissioning reference group which is represented by patients all over Thurrock. They sit in directly on the board, on our clinical commissioning board. Never in the past in NHS England's history or its predecessor where patients or the public voice was heard so strongly. It is not only heard strongly today, but it also had its effect in effectively making these changes. So ladies and gentlemen, we have a crisis in hand. But believe me, this crisis is being tackled on a war footing, and it's being tackled with your help. Not because of what I believe in, but because of what you believe in. So the entire evening is dedicated to you, for you to express your views, ask me any number of questions. I'm not that clever, so I may not have all the answers, but I will definitely come back to you. We talked about care quality commissioning inspections and GP surgeries failing. What we have done is, what we have recognized is some GP surgeries did not have the expertise to sort of prepare for these inspections and improve care. Thurrock Clinical Commissioning Group is one step ahead again. We have identified a separate scheme where we've got locality directors who will liaise with the surgeries, identify these problems before the inspection occurs, identify the problems so that GP surgeries can improve. So by doing that, we're not doing that to make them just pass the inspection, but make sure the quality comes up as well. We're not going to let down surgeries which have failed, which have already sunk. We've also identified how we're going to improve these surgeries. So we're liaising with them very closely to see what sort of help they need, how they can improve, and make sure they're ready for the second round of inspection. And by doing this, we're ensuring the quality of care is not substandard at all. We're going to improve everything. Thurrock's Clinical Commissioning Group organizes regular study days once a month for the GPs and the nurses and brings in speakers from all over the place so that the quality of care they provide is good. They're up to date with their knowledge and they provide good quality service. NHS England mentioned about GP validation. Revalidation is quite new, but every GP in the country, including Thurrock, has to go through an appraisal process every year, and that is going on for more than a decade. So GPs are being appraised every year on the quality they provide, on the updates they do, and what they have done to improve the services. Your complaints against GPs are also discussed during the appraisal process and also during revalidation. So everything is being addressed, not just what the GP provides, but also what you think about the GP. What you mention on their websites and NHS choices will also be discussed.
Thank you.
Thank you very much.
I found that very helpful, actually. So it was a good time for the old computer to say no. But that leads us on to Ian, and he's going to give us a vision of what's a view from the bridge. Oh, we haven't got it yet. Can you do it off of your pen and paper while somebody... yeah?
Technology, media.
It's such a good presentation.
I'm always plagued by IT problems. So my council colleagues will attest.
Can you start and then we'll catch up with the IT?
I'll try.
I may not. The vision of the future and...
Okay. So my name is Ian Wake. I'm the Director of Public Health. I work for the council. But I have a slightly strange role because I'm also responsible for providing independent advice to the NHS to try and help them to improve your health services. So I've been asked to do, it says on the programme vision for the future, but I've been asked to do 3 things today. Have we got any IT? No. The first is to talk about the data and what the data and the evidence tells us about the population of Tilbury and its health. I suspect I'm not going to tell you anything that you don't already know, but I want to tell you anyway because I think it's shocking and I think it should be on record. Secondly, I want to just present some of our ideas in terms of how we could improve things. And finally, And most importantly, I want to hear about your ideas in terms of what you think needs to happen to improve things. Do we have any? Christine,
It was working a minute ago.
He's a doctor.
We're nearly there, people. Yeah? Here we go. Be quick or it might turn off.
Stand there, don't move.
It's going to fall over there. Don't fall over me.
okay, so
Yep.
Oh!
The first thing I want to say to you, and perhaps the most shocking, that too many of our residents in Tilbury are dying too young. If death rates in Tilbury were the same as they are in England, as opposed to being much higher, we would have 43 fewer people dying before the age of 75 every year. 43 additional people walking our streets. 16 fewer people dying of a heart attack or a stroke before the age of 75. And 13 fewer people every year from Tilbury dying of cancer. And the sad fact, ladies and gentlemen, is this, that a Tilbury baby born today is predicted to die 10 years before a baby born in Orsett, which is, what, 7 miles up the road? This is 2015, and that statistic should shame us all. Why? Well, I have to say, part of the issue is the lifestyles in Tilbury. So out of every 100 adults in Tilbury, 31 will smoke. Whilst in Orsett, it's 18. And if we think about our children, when they start school at age 5, in Tilbury, 13 out of every 100 will be obese. In Orsett, its figure is 8. But this isn't the only driver of those horrible statistics in terms of death. So of the 100 adults who live in Tilbury, your local GP will be treating 15 for high blood pressure, 11 for depression, 7 for diabetes, 5.5 for asthma, 4 for heart disease, and 2.5 for chronic lung problems, things like emphysema, called COPD. Now we come to the question that I know a few of you are keen, including Councillor Rice, to know the answer to, which is how many patients is my Tilbury GP responsible for? Well, I'll give you some figures. These figures come with a little bit of a health warning in the sense that they were published in March of this year, and so they may be out of date, particularly locally. And secondly, they don't account for locum doctors, so these are only permanent full-time doctors. So the little amount at the top equals 200 patients, because I can't fit 200 patients on the screen. So in England, this should give you a feeling in terms of the difference in size. In England, every full-time GP, on average, has a list size of patients of 1,321. That's the average. Someone said earlier, I think Dr. Roger said, Thurrock is one of the most underdoctored areas in the country. He is correct. In Thurrock, the average full-time GP has a list size of 2,071 patients, or 750 more patients than England's average. But then we come to Tilbury. So, Dr. Sutherland, England's practice. 2,338 patients. 1,017 more than England. Dr. Ramachandran's 2,619, or nearly 1,300 more than England. The Science Medical Centre, 2,767, or 1,446 more than England. Look at Pedagog, 2,875 the full-time GP, or 1,554 more than England. And finally, Dr. Shahada, 6,962, or 5,641 more than England. Now, as I said, these figures mask the number of locum doctors, but my proposition to you is that a surgery run by locum doctors is not a good surgery. You see a different doctor every time you turn up. The doctor doesn't know you, so you have to explain your health conditions again. And we know there's oodles of published evidence that if you are seeing locum doctors and you don't have what's called continuity of care, seeing the same doctor time and time again, you are much more likely to end up in hospital. And ladies and gentlemen, I think these figures are a disgrace. How many patients is my practice nurse responsible for? 200 patients again. England, 3,729. Thorough? 6,731. Central England, 11,133. Obviously, there aren't that many patients in Dr. Central England's practice, or wasn't. However, there was only a 0.2 whole-time equivalent or 1 day a week nurse. That's where that ratio comes from. Ramachandran, I'm afraid, as of March of this year, didn't have a practice nurse. Nor did the Science Medical Centre. So I was getting a bit bored by this point. Doing this on Sunday afternoon. He's very good at these things. 6,599. And actually, Shard does a bit better. I'm sorry, in the way. 5,030. So, to summarise the underdoctoring and undernursing, Tilbury today, in terms of full-time equivalent GPs, has 8.5 full-time equivalent GPs. The ideal situation, and I define the ideal situation just as being the average in England, would require us at Tilbury to have 20 3/4 full-time GPs. And in terms of practice nurses, we've got 3 7/8 practice nurses. That last one just lost a little bit of her arm. The ideal situation, again, bringing to the England average, 9.5. So where do you think you're all going because you can't get a doctor's appointment?
The cemetery.
Hopefully before the cemetery. Before the cemetery.
We can't afford to die here, Bob.
6,637 of you, these are patients from Tilbury practices, trekked up to Basson Hospital to an A&E last year. So I looked at actually how that broke down. So what was happening to those 6,637 patients. So for every 10 Tilbury residents who visited Basson Hospital at A&E last year, 5 of them had no test and no treatment. Their condition was so minor. What they wanted was reassurance from a doctor. Another 4 of them had only a minor test or a treatment, and it was only 1 out of every 10 that received emergency medicine. And the reality, therefore, is that 9 out of the 10 were attending A&E for conditions that ought to be provided near home at the doctor's. Do you know how much that costs extra £418,000. The NHS is spending £418,000 on Tilbury patients to force them to trek up to Basel A&E to get treatment that should be provided in Tilbury.
Exactly.
So, to recap, we have unhealthy lifestyles, we have long-term illnesses, we have too few GPs and nurses caring for too many patients, we have unnecessary trips to A&E, and we have too many people dying too young. And my proposition to you is there has to be a better way. So let's try and leave the doom and gloom behind and think what that better way may be, and then I'll open it up to the floor in terms of how we can solve this problem. So what does health and well-being mean to you? When you ask doctors about health, they tend to talk about illnesses, they tend to talk about treatment, about hospitals. But actually, when you ask the general public, what does health and well-being mean? They are generally a lot more positive. So we at Thurrock Council actually did this. We did this last year in something called the Fairness Survey. And we asked our residents what was fair, what was good, and what was bad about health and well-being, and what it meant to them. And these are the kind of things that they said. So support for the disabled or the elderly, worked all their lives and are having a hard time. I've lived in Thurrock for 30 years and I love it, but I want better schools and better GPs. I'd like better transport to hospital. I'd like more support for carers. Well-being for me is about having a good job. How true that is. If you have a good job, you're far more likely to have good health. And living in a friendly community. Too many of our local residents are lonely and are isolated. We know that being lonely and isolated has a terrible impact on your physical and mental health. Somewhere affordable and decent to live. Housing has a huge impact on health. Better access to GPs. It takes me 2 weeks to get an appointment. And so how do we solve this? Well, we have a massive problem with recruitment, with retention of GPs. We all fully accept that, and we live in the real world. But equally, we have to have a vision. And bizarrely, though things are really bad, now is a really amazing time and a really amazing opportunity in Tilbury. And if you bring that all together, we have an opportunity to build, as part of Thurrock Council's regeneration programme, a new GP surgery with enough GPs and enough nurses. But what could we add to that to actually look at the well-being agenda to try and help keep people healthy? We could add diagnostics, for example. We could add blood tests and x-rays in this new facility to stop people having to trek up to Basildon Hospital. We could possibly add some hospital services, something called the NHS 5-year forward view. The Chief Executive of the NHS is rather keen on this, in actually bringing hospital services out of hospital and putting them in the community. We could have mental health. Mental health services are provided generally a long way away from physical health services. This is madness. Why can't we have counselling services within primary care? We could, for example, have some healthy lifestyle services. Stop smoking, healthy eating, weight loss, to help address some of those differences in the lifestyle behaviours between residents here and the residents in Dorset. We could have a load of therapists, physiotherapy, occupational health, community health services that could help with those long-term conditions, people living with diabetes, for example, or with COPD, with bronchitis and emphysema. But then we could grow out more. We have a good track record in Thurrock in terms of our community hubs and community development. We can help offer a flexible space for community groups to try and break down some of that isolation and that loneliness. We could offer housing, death and employment advice services. We know in England that 15% of appointments taken up in GP surgeries are for issues that don't have a clinical underlying cause. They're people stressed out because they are worried about their rent, or they're worried about being in debt, or they're worried that they're going to lose their jobs. We could add in adult social care services. We could add in exercise facilities and groups. We could put in a community cafe. We could put services for children and families. And we could put in 1,000 other things. And I'm not suggesting that we should have all of these things in Tilbury. I don't know. But what I want to know is what you think. But we have an opportunity with the regeneration, with the commitment of the council and with the commitment of the CCG to create something amazing for Tilbury, and I am determined that we do it. And so it's over to you. What do you think? Would you use it? And most importantly, what should go in it? Thank you.
thanks, Ian. And I think that I hadn't seen any of that, and I think there were some pretty scary stats in there for even those of us that, no, it's not good, but we didn't know it was that bad. Okay?
Something that wasn't brought up there is the pollution that we suffer in Tilbury.
Absolutely.
The
Yes.
terrible pollution.
Yep.
I can't open my windows. I live in the dock. I can't open my windows because of the mess coming out of the dock. I get brown dust every day. I sweep my garden. I've complained about it. A lot of our illnesses is due to pollution.
Madam,
Not cigarettes, I don't smoke.
Madam, you're absolutely right.
It's disgusting what we have to put up with. It is. When the wind's in the wrong direction, you can't go out. You can't go out. Not where I live, you can't. Nothing's been done about it. I have been in the dock and had a meeting with them, but we're hoping something's going to be done.
We do.
When you've got piles of rubbish and dirt just the other side of that wall, the minute you get a little bit of wind, it's blowing in all our gardens. It's going down our children's noses. It's disgusting. Pardon? And the metal, the crushing metal Mickey in there, that's a nightmare. That is a nightmare. They're just dropping iron girders down, and it's all... We know so that is part of our health problem as well.
And that adds to chest problems and
it is.
And your past health problems. I know that it's added to your, but it's probably not a discussion.
But that's what I wanted to point out. It's not just
cigarettes.
It is
it's the other stuff that we live with here. Yeah. We are an industrial town, and with industry comes the fumes. You know, we all live in amongst industry, and all of a sudden we've all got to live in as a community.
It has never been as bad.
Industries.
I've lived in my house 50 years. I've always lived near the docks. I worked in the docks for 30 years, and never, ever have we had the pollution that we're getting now and the noise.
You know that I'm absolutely listening to you, don't you? Because I do represent you. You know.
Yeah, I know.
You know that I'll always fight.
Yeah.
Okay, right, thank you. So, so what, the offer of a new health facility, you know, we have to make sure that we grasp that with two hands and that it never gets taken away from us. We know that we're going to have it. They've got to do something in Tilbury because people are literally dying because we don't have it. So I think that what we'd like to do is give Ian some ideas. I'd like to maybe see a few hands go up. What should be in there? Should it be smear testing? Should it be, you know, X-rays? Should it be a health and well-being centre? COPD? Anyone who's got COPD, you can't get tested in Tilbury for it.
And why have we got to go all the way to all sit
and why
should you?
For a blood test? Absolutely. So should it be blood test there? That's what we need to do. We need to do a planning for real exercise about what does our new health facility look like. And we need to be involved in that, because you know what happens when you don't get involved? You get what you didn't want.
Yeah.
Okay? So I'm going to be involved. I'll always be involved. If there's something for me to represent Tilbury, then I'll do that. In my own time, I'm happy to do that. And I want a few of you to come along that journey to make sure that not just you sitting in this room, your mum, your dad, your children deserve a better facility, and we need some people to come on board, give Ian some ideas to make sure that we do that. Yeah. And I've just been told we've got to be out in 15 minutes. Sorry. Sorry, come to you. Yeah.
Just a suggestion for you, the old coffee shop's going to be empty soon.
Yeah. And my house is empty and all.
Okay. All right then, so it's the building needs to be the right building. The building needs to be central, okay? Yeah, absolutely. All right then, I'm going to do this one in 5 minutes because I'd like some people to grab people, the right people, and to put your name forward so that I'm not on my own, because I don't want to make those decisions.
How much is it going to, I mean, your idea of a medical centre, how much is it going to cost realistically? What you thought about, you know, the ideas you've got? Is it genuinely sustainable? Where's the money coming from? Is the council going to have to put some of that money in? Is it going to come from national funds? And is it going to be sustainable?
That's a very good question. It's partly probably above my pay grade because I'm not an expert in regeneration development. My understanding is that the council can borrow the money because we are, as a council, can borrow capital. If if we then lease the space to various different providers within, for example, the NHS or Baton Hospital have expressed interest, I think, of moving some of their services, the council will get a rent from the NHS, which will make the thing sustainable. Remember as well, though, that £418,000 bill that we're currently picking up, it is much, much more expensive to treat someone at Baton Hospital for something minor than it is to treat them within the local community. Much more expensive.
So it would be the capital expenditure.
So that would be a revenue saving, the 418,000.
Duty to put the capex in.
Correct.
Sorry, I've got a man up the back in front of you.
Perhaps it's time we bit the point and put children first for once, instead of having candidates to be up top. I went to a conference last year where there was a call about setting up medical hubs, where it was integrating medical services in one central point. So let's bite the bullet and make Tilbury the forerunner of the medical hubs in Thurrock, because that's the way it's going to be going forward in the future. Because we do need to be working now on, I mean, at the moment it's all great in the future, but it doesn't look good in children now, the doctors. But it needs to be sort of to do it, to say, right, this is what we're going to do in Tilbury. If we can find an existing property, the police station, whatever, so you take the cost and build like the actual new build out here, you can use that facility, it's got good access, obviously got good access, it's got disability access, it's got good transport needs. Then you can start building the services, but primarily for doctors, and also some of the testing procedures, but build it slowly. Don't sort of go over the top, but build it with areas that can be developed in the future. For prevention would be one as well. But the primary concern is to get doctors into Tilbury. By setting up a new hub, could be the forerunner of the way health is going in Thurrock. Let Tilbury be the first to start.
Thank you. And a brand new building with new medical and top of the range facilities is what I'm hoping is the hook-in for some of those brand new young doctors to treat us and give us the medical care that we deserve. So I think that that's the idea of the panel, is if we create something that those new doctors want to come and work there. Okay? They're not coming here as a last hope, you know, they're coming here because we are going to have the best facilities, and I'm going to drive that. I promise you I will be at the front driving that. To the third row, I've got you after.
The man at the moment, Dr. Harday, thinks our car park will get it Tilbury and built a super duper, all things going to be a super medical centre. What happened to that? Become a disastrous doctor centre.
Panel?
We've got a massive building down here, massive of space.
We lost our car park and got a doctor's surgery that wasn't a good doctor's surgery. So just a quick...
And Dr. Shahade funded that himself. So that was Dr. Shahade funding. The GPs have run their own little business. So Dr. Shahade got the fundings to develop that surgery for him to practice from.
The promise at the time was super duper medical.
Right. We've got a lot of grant. Okay, I'm going to move on to the gentleman at the side, and I'm sorry, but it's going to be my last questions because I want you to have 5 minutes personally with the panel and to fill in any forms or to speak to any of us there in the room.
Could I have the panel's view in general as what we're going to do about preventing the need for medical attention in the first place, i.e. something with health promotion, health education, exercise for health, certainly coronary heart disease, which I was involved in the past, some strategy which would be part of the hub for prevention of medical problems, reducing the need, possibly, and indeed medicalisation.
A man after my own heart.
Oh, sorry.
No,
you can go. No,
getting overexcited. So we have something called a health and wellbeing strategy for Thurrock, which fortuitously is about to come up to be refreshed. So I have to my left Councillor Rice, who chairs the Health and Wellbeing Board, and we have agreed a process to redevelop the strategy. Prevention and early intervention are one of the 4 key strategic aims. It will be embedded in all of the core agencies. We need to look at both tertiary prevention, so where people are already ill, if they've got, say, high blood pressure, what we're doing to get it down so that they don't progress on to having a stroke. If they've got atrial fibrillation, what we're doing to try and control it, such as they don't progress on to have a stroke. And then also all of the primary prevention stuff. We need to embed primary prevention in all of the agencies. So it's the responsibility of Baton Hospital. I know we have and one of my director colleagues at the back who is absolutely dead up for this in her new role. We need to embed it in primary care. We need to embed it in all of the frontline staff of the council so that if they're seeing someone who's smoking and wants to quit, they can make a referral. We have to do it in a systematic and organised way, and that's actually, in my view, the only way that the NHS in the long term will be able to financially survive.
Here.
Can I just, last week we had another meeting, another evening meeting, we had a regeneration meeting about the plans for and the Health Hub fits perfectly into the regeneration plans of Civic Square and along Calcutta Road. And one of the things that came out of it is we can't see a doctor, but I can get a Chinese, a kebab, an Indian. Okay, I can get loads and loads of takeaways, and it's got to be a joined-up approach. Okay, because what we haven't got is we've got oh, you can open that there, you can open that there. There's a great gym in the Gateway Academy, underused, active Tilbury, they've got the academy, the classes are packed out in there. There is stuff going on, there's running clubs, but who knows? Yeah. You know, we've got to have the community hub, which will have its, it's had a small launch, it'll have its wider launch in January. We've got to make people aware of what's going on, because we can't have a disjointed approach to everything. We've got to make it healthier. We've got to make the services available so that people can have a healthier lifestyle. And a healthier lifestyle will be a longer and better life. Okay, so I don't know if anybody else had a view on that, but that's what